You know, have you ever really thought about what happens after a successful surgery abroad? We get so focused on these amazing medical procedures, this idea of medical tourism, but the journey? It doesn't just stop when you're wheeled out of the hospital. Nope. In fact, that's often where the most critical and riskiest part of the whole thing begins. Let's unpack that through one person's story.
So, I want you to meet Peter Mwansa. His story is the perfect example of this hidden challenge in cross-border healthcare. Because, as you're about to see, getting that successful surgery was literally only half the battle. He did everything by the book, traveled for the best care possible, had a fantastic outcome, but that was just the beginning.
All right, let's jump into Peter's story. It all starts, as these things often do, with a lot of hope and a search for a real solution to a problem that's been going on for way too long.
Okay, so Peter's a 58-year-old civil engineer from Lusaka. For years, and I mean years, he'd been living with this nagging, chronic knee pain. After trying all the local options, his specialist gave him a referral for a top-tier facility to get an advanced joint replacement. The place? As-Salam International Hospital, all the way in Cairo. Now, that's a huge decision, but when you're promised a life without pain, it suddenly becomes a pretty easy one.
And you know what? The trip totally paid off. This surgery in Egypt was a massive success. The pain he'd been carrying for years, gone. He could move again. By every single metric, this was a medical tourism success story. But then, he went home.
And this, right here, is where we run into the real problem. It's something we're calling the recovery gap. It's that super critical time after a patient leaves a world-class hospital and steps back into their local healthcare system.
The second Peter's plane touched down back in Zambia, that seamless, amazing system of care he had in Cairo, it just vanished. Poof. There was no direct line to his surgeons, no clear structured plan for his physical therapy, and definitely no one watching over his recovery. He was, for all intents and purposes, completely on his own.
And look, Peter's situation is not some one-off thing. It points to a huge, well-documented problem. Just look at this quote from The Lancet. It says that a lack of post-op follow-up dramatically increases the risk of complications and even getting readmitted to the hospital. So this isn't just an inconvenience we're talking about, it's a serious medical danger.
This gap creates very real risks. When that connection is broken, serious complications can just go completely unnoticed. Patients like Peter are way less likely to stick to their rehab exercises, which are absolutely crucial. And the worst part? The incredible results of that expensive, life-changing surgery can just deteriorate. All those months of successful treatment abroad can be wiped out in a matter of weeks.
So this brings us to the million-dollar question, right? When a patient flies hundreds or even thousands of miles for a procedure, how on earth do you make sure that same quality of care follows them home? How do you bridge that gap?
Well, the answer lies in building a system that actually connects those two different worlds, the international hospital and the patient's home. It's really about building a bridge.
And this is where a platform like AfriPharm Health comes in and completely rewrites Peter's story. The whole idea is simple, but it is so powerful. For Peter, the care doesn't just stop when he's discharged. Instead, it transforms. It becomes a connected, structured, and constantly monitored recovery process, right from the comfort of his own home.
Okay, so how does this actually work in the real world? Let's get into the nuts and bolts of this healthcare network and see exactly how it takes this fragmented, scary journey and makes it continuous and safe.
So for Peter, his new recovery plan is broken down into 5 super clear steps, and it's all managed through one platform. It all starts with a simple request and then builds out into this comprehensive support system that brings everyone together, from his surgeon back in Egypt to his local nurse right there in Zambia.
Let's start with the foundation of this whole thing, the health vault. Seriously, just think of it like a digital file that travels with Peter. It's got everything, his surgical reports, all his scans, the super detailed recovery instructions from his Egyptian doctors. What does this mean? It means his local care team in Lusaka isn't playing a guessing game. They can see exactly what was done and what needs to happen next. That information gap, it's gone.
Next up is the Virtual Care Network, or VCN. This is the bridge we were talking about. Through this platform, Peter's surgeon in Egypt can have remote follow-up appointments, check out his progress, and spot any potential problems really early on. All of a sudden, thousands of miles don't matter anymore. The expert who did the surgery is still a core part of the recovery team. We all know how critical those post-surgery medications are. This platform basically digitizes that whole process. His prescriptions are tracked, Peter gets automatic reminders so he never misses a dose, and it even flags potential drug interactions. They even handle the refills through verified partners.
It's like a digital safety net for his entire medication plan. And finally, his physical recovery. Instead of just being handed a piece of paper with some exercises on it, Peter's physiotherapy is now actively guided and his progress is tracked. His local therapist and his surgeon way back in Egypt can actually communicate, making sure his rehab is perfectly in sync with the surgical plan. Recovery is no longer a shot in the dark, it's structured.
Okay, so let's zoom out. What's the big picture here? What does all of this really mean? Well, it's all about protecting that initial investment. The investment of time, money, and most importantly, hope that goes into getting medical care abroad.
I mean, this slide just says it all, doesn't it? You go from a recovery that's fragmented, uncertain, and risky to one that is connected, structured, and monitored. The patient is no longer left feeling isolated. Their incredible outcome is actively being protected. It's a complete shift in how we think about that final and maybe most important phase of care.
And this is the one thing I really want you to take away from this. That journey is not over when the patient walks out of the hospital. In fact, that's the exact moment when the success of the entire treatment becomes the most vulnerable. Without that structured, cross-border follow-up, even the best surgery in the world can begin to unravel.
Which kind of leaves us with one final thought to chew on. We've pretty much mastered the logistics of getting patients to the best doctors anywhere in the world. But if our most advanced medical treatments can cross borders so easily, shouldn't our standard of recovery be able to do the same?